Hi, my name is Luis Felipe Camacho and today I will be teaching you about respiratory system emphysema. Its function is obtaining oxygen and removing carbon dioxide. Other functions filter air, produce sound, sense of smell, and regulation of blood. Its respiration, the process of exchange between the atmosphere and the body cells are: first step, movement of the air and lungs; second step, exchange blood and the air in external respiration; third step is gas transported in blood, and fourth step, gas exchange between the blood and body cells. The organs of the respiratory system. The upper respiratory tract is nose, nasal cavity, paranasal, sinus, and pharynx, and lower respiratory tract is larynx, trachea, bronchial tree, and lungs. But today I will be specifying on the lungs. So the lungs are soft, spongy, one-shaped organs in the thoracic cavity. The breathing mechanism: inspiration into inhalation, expiration into exhalation. Inhalation is the diaphragm moves downward and the atmospheric pressure in the alveoli falls, which forces air into the airways. Exhalation: in the exhalation, muscles relax, elastic recoil from the surface tensions forces and out. Problem of emphysema. Emphysema is a type of COPD disease more known as chronic bronchitis affecting the air sacs in the lungs, which is more often in adult people. It could lead to inflammation and excess of mucus in the air sacs. COPD is an umbrella term used to disable progressive lung diseases including emphysema. Emphysema is a lung condition that causes shortness of breath. Over time, the inner walls of the air sacs weaken and reprotrude, creating the larger air spaces instead of many small ones. Example: normal function. When you exhale, damage in the alveoli don't work properly and old air becomes trapped, leaving no room for fresh oxygen-rich air to enter. Most people with emphysema also have chronic bronchitis, that is, inflammation of the tubes that carry into your lungs, which leads to a persistent cough. The symptoms: you can have emphysema for many years without noticing at all, but the main symptom is shortness of breath, which usually begins gradually. You may start avoiding activities that cause you to be short breath, so the symptoms doesn't become a problem until it starts interfering with the daily tasks. See your doctor if you've had unexplained shortness of breath of several months. Don't ignore it by telling yourself it's because you're aging or out of shape. Seek immediately medical attention. If you're so short of breath you can climb stairs, your lips are fingernails turn blue or gray with exertion, and you're not mentally alert. Smoking is the primary cause of emphysema, which makes it a preventable illness. There are also less common genetic causes of emphysema, including alpha-1. Early in the disease, shortness of breath may occur with exercise and activity, but symptoms gradually worsen and may occur at rest. Once present, emphysema is not curable, but its symptoms are controllable. Medication are available to preserve functions for daily activities. Exercise, training, and education are essential components of emphysema therapy and pulmonary rehabilitation. What are the stages of emphysema? First is mild, greater than or equal to 80% predicted. Second is moderate, less than 80%, greater than 50% predicted. And third is severe, less than 50%, greater than 30% predicted. And in the fourth, very severe, less than 30% predicted or less than 50% in chronic respiratory failure. How can science help or solve emphysema? Science can help a diagnosis to determine if you have emphysema. Imaging tests are chest X-ray that can help support a diagnosis of advanced emphysema. Lab tests, blood taken from a RV can be tested or to be determine how well your lungs transfer oxygen into and remove carbon dioxide from your bloodstream. Science can also help in the treatment that relieves symptoms and solve the progression of the disease. Medications: bronchodilators can relieve coughing. Inhalators, steroids reduce inflammation and may help remove the shortness of breath. Antibiotics: if you have a bacterial infection like bronchitis, antibiotics are appropriate. Science can also help or try to solve the problems with different type of surgeries such as lung volume reduction surgery and lung transplant. But the most important treatment is to stop smoking.